The person coming up is Hillary Heichman, Planning Committee Chair for this event and Senior Program Officer at the Robert Wood Johnson Foundation. And she's going to talk about from a call to action to how to. So I think we might be touching on what you just brought up.
Hi, everyone. So let's see. As a little closer, here we go. In my more than a decade at the Robert Wood Johnson Foundation, I've been privileged in a lot of ways. And one of them is that I get to listen to a lot of people talk about their ideas and share their wisdom and their sense of what it's going to take for communities to be healthier, of what it's going to take for everyone to have an opportunity to be as healthy as they can be all across the country, what it's going to take to have great, reliable, affordable health care and a public health system that really works for everyone in all communities across the country. And being exposed to so much of these ideas and wisdom, I get to see patterns. It makes me feel wiser than I might otherwise feel. And many of them align with patterns, with sort of remarks that you've already heard this morning. So the next few things I'm going to say will sort of resonate in line with that. So here's a couple of big things that I've taken away in recent years. First of all, we often benefit from going bigger, from thinking bigger. And we need more problem solvers. So let me say what I mean by both of those things. By going bigger, I don't just mean for planning and thinking in bigger scale, and I don't just mean planning and thinking in terms of longer time horizons. I also mean planning and thinking and working together in a more interconnected way. And I also mean approaching issues in a way that addresses more than one thing at a time, what some people call multi-solving. And I also mean building things to last as opposed to doing temporary work. And by saying we need more we need more problem solvers, what I'm really doing is referencing Heather McGhee again, as Dave did earlier, and what she talks about is the solidarity dividend. As she, I think, has said, it is to our detriment that we leave out problem solvers and their solutions. And that is talking about, and that's a reference to all different kinds of people from all different kinds of points of view and parts of the country and different backgrounds and growing up in all different kinds of ways, that we really will benefit from bringing in more different kinds of problem solvers and solutions. So let me pause. And let's reflect on where we're going the rest of today and tomorrow morning. Coming up next, after a break, we'll get a break, and then we're going to have a gallery walk of sorts, and we'll dig into some promising efforts that arose over the last few years. And we're not just going to look back on what we wish we'd done. We're going to remind ourselves that we have a lot to build from. And then, after that, we're going to dig in to the two significant reports that were sort of the impetus for this event today, for us coming together in this way. For the Public's Health, which came out in 2012, and the third in the series came out in 2012, and the U.S. Health in International Perspective, known as the Shorter Lives, Poorer Health Report from 2013. So we'll reflect back on those and the decades since. And then near the end of the day and through tomorrow morning, we're going to consider paths forward together. So yes, we'll get some reflections from some really inspiring thinkers and doers, but for the most part, we are going to inspire each other and think how we think about the paths forward. So stick around to the end. This isn't one of those events that'll be a good one to sneak out early. Please hang out with us all day and come back tomorrow. Do anything you can to come back tomorrow, because we're going to have a rich, rewarding experience building from each other, imagining different paths forward together. And as James has teed up for us, it's going to be very participatory throughout. This isn't just like this isn't like other symposiums that I've been to in the past. So I want to highlight a few of the things you've already heard. I want to sort of put my finger on some things so that we can pull forward threads and ribbons from this morning throughout today. As James highlighted early on, the value of asset-based and appreciative inquiry, and that what we are doing is hosting. Dr. T talked to us about the power of this moment. It's an opportunity to tell the story of our time differently. Let's not overlook the successes of the last few years, and let's leverage them going forward. Let's leverage the ingenuity that we have shown over the last few years going forward, and the willingness to work differently. We don't want to be a wreck on a wreck, as she said. Let's attend to public and political will building, and how can we get people to lean into something that is bigger than this moment. And also remember, it's often been disruption that has forced us into action. Anita talked to us about the value of having a health goal that can land for many of us, or all of us, and really stick. She talked about that we can we approach what we are doing such that it adds up to transformative change, so it adds up to something bigger and something that is more cohesive. And let's be careful about losing the forest for the trees. She also talked to us about how we in the field can make narrative connections to things like human potential and thriving, really powerful ideas. And that we need to be honest about where the American public is and where to start from. Are we bold enough to say we'll give up some things? And she challenged us to be bold and grand. Dave, he talked to us about he highlighted the drop in life expectancy, and that it has happened on our watch while we have been in these roles in health over these last number of years. Let's not lose track of what we've lost, of the birthdays lost, of the lives. What can help us have a different kind of meeting 10 years from now? He challenged us. And he said, as others this morning have, that we need new narratives, ones that are stickier and ones that spread of their own accord. New narratives have to scramble existing identity frameworks. And in the last few years, we've seen that it's possible to do big things. So I want to pause and say thank you to the Planning Committee. I am proud of what we've created together and what we all get to participate in today. And I'll leave everyone with a couple of questions before we slide into a break and then come back to it, because we have a lot of exciting discussion, interaction ahead of us. So the two questions I'll leave us with are, how do we build public will around thriving as business as usual? And what are the assumptions, stories, patterns, and approaches that have served us? And what do we need to set aside? And so with that, back to James and to the break. Thank you, everyone, for joining us.
Yeah. Awesome.